If you endure severe acid reflux while diving, you know exactly how fast it can ruin a trip. When medications fail, surgery starts looking like a highly appealing way out. Enter the LINX Reflux Management System. It is a permanent surgical implant placed right around your lower esophagus to block stomach acid from rising. But if you dive, that description triggers an immediate red flag. Voluntarily installing a ring of metal inside your digestive tract sounds like an automatic disqualification for a high-pressure sport. This animated matrix breaks down exactly who needs to figure this out. We have prospective patients weighing the surgery, post-op divers planning their return to the water, and dive instructors evaluating student medical forms. For all three, everything points to one central question. Is LINX a hard stop for diving? The short answer is no. But getting back in the water safely has nothing to do with the titanium hardware and everything to do with how your body physically adapts during recovery. This diagram shows the LINX device, magnetic beads pinching the lower esophageal sphincter closed against reflux. Pulling back, unlike a gastric band, your stomach's anatomy remains intact. Zooming in, each bead consists of a solid titanium shell and magnetic core containing 0% gas. When you descend underwater, your lungs and sinuses compress because they contain air spaces. Solid titanium and magnets do not. Because the hardware contains no gas-filled components, ambient pressure changes cannot crush or damage the device. The mechanical implant is entirely safe at depth. This means the risks we have to manage belong entirely to your biology. A frequent side effect of LINX surgery is dysphagia, the medical term for difficulty swallowing. This creates immediate friction with your pre-dive prep. If swallowing is uncomfortable, you naturally avoid drinking water on the boat, which drives up your risk of dehydration. It also complicates your required oral medications. Trying to force down a motion sickness pill right before gearing up can quickly become an ordeal. Once you hit the water and start your descent, you need to clear your ears. Many divers rely on the swallowing technique to open their eustachian tubes, a process that dysphagia makes highly painful or entirely impossible. Lingering dysphagia turns routine dive tasks into active safety hazards. If you cannot comfortably hydrate or equalize on descent, you are not fit to dive. Watch this diver breathing from their regulator. It is incredibly easy to accidentally gulp down small amounts of compressed air along with a normal breath. According to Boyle's law, as you ascend to shallow to water and ambient pressure drops, that swallowed compressed air will expand inside your stomach. Normally, your body vents this expanding air by belching. While the LINX device is designed to open and allow a belch, patients often find the process takes significantly more effort and happens less frequently than it did before surgery. If that expanding air gets trapped, the immediate result is severe gas bloating and sharp abdominal discomfort during your ascent. Dealing with intense abdominal cramps while trying to manage your buoyancy and execute safety stops creates dangerous task loading. It distracts you during the most critical phase of the dive. We also have to plan for post-dive emergencies, specifically if you ever need treatment for decompression illness or DCI. When evaluating a diver for suspected neurological hits from DCI, emergency medicine physicians frequently rely on advanced imaging to check the brain and spinal cord. This medical warning highlights a vital limitation. The permanent magnets inside your LINX device come with strict MRI compatibility restrictions. The magnets will never affect your physical ability to complete a dive, but they absolutely restrict the diagnostic tools your doctors can use if you end up in an emergency room. Let's look at the diver's LINX clearance protocol. If you've just had the device implanted, your immediate reality is mapped out right here. 0 to 8 weeks means absolutely no diving. You need a bare minimum of 6 to 8 dry weeks to let your internal tissues scar over, anchor the device, and stabilize. Once you pass that 8-week mark, the flowchart branches into a strict physical checklist. You need to confidently answer yes to swallowing comfortably, belching on command, and experiencing 0 persistent chest pain. If you are still suffering from uncontrolled reflux or dealing with rare complications like the device migrating out of position, your return to the water must be deferred indefinitely. Pushing to dive before your esophagus has mechanically adapted to the implant invites severe complications. You will spend the entire dive fighting your own anatomy. If you're a dive instructor, you will eventually have a student check yes to gastrointestinal surgery on their medical form and mention a LINX implant. Looking at the instructor path on our flowchart, the immediate action is a yellow light, pause training. A LINX device is neither an automatic pass nor an automatic fail. You need to ask them exactly when the surgery was performed, whether they have resumed unrestricted normal activities, and how well they are currently managing swallowing and belching. The protocol ends here at the green node, individual assessment. To get them in the water, you must require written clearance from both their upper GI surgeon and a physician specializing in dive medicine. Because healing times and post-op symptoms vary so widely, an individualized medical assessment is the only legally and medically sound way to authorize a return to diving. Getting the LINX device means trading chronic, dive-ruining acid reflux for a temporary healing phase and a mechanical adjustment in how your body vents expanding air. If you respect the recovery timeline, master your new bodily mechanics, and secure the right medical clearance, the implant clears the way for a much safer, vastly more comfortable future underwater.